here we are going to discuss about the community health nursing syllabi. Syllabi is important. Before to start the course, every student must know what are the content of syllabi, right? So nursing syllabi is a complete package for training the program. And also the syllabi include the both core subject, like I said, fundamental of nursing, then maternity, pediatrics, physiology, nutrition, right? Also additional subject of courses, like I said, community nursing and leadership. So if you ask me, this subject is a community health nursing, right? Community health nursing, also we called public health nursing or community nursing. It is a combined primary healthcare and nursing practice in a community setting. And community health nurse provide the health services and preventive care, intervention and health education to communities or population. Let me explain what are the content of this course. Here showing the order of content. First of all, community health, what it is. I already told you the community health, we also call public health nursing. And community health, it is that combines with the primary healthcare and nursing practice in the community setting. So the community health course syllabi, basically module 1, it is the introduction of the community health nursing. Module 2, the art and science of community health nurse. And module 3, the factors that influence the health of the communities. And module 4, right? What are the aggravatings the community grade in community health, basically? So community health nurse basically provide the health services. It can prevent the disease, intervention and health education to the communities or population. What else? So community health nursing, next here, what is our course syllabi? First of all, course title. This is NUR 109. This is the subject code. And community health nursing, the subject name. The semester credit hour and clock hour theories. Total 3 credits, 15 hours. Do I need any kind of pre-requirements before start this subject? Absolutely no. Any core requirements? None or no. Instructor, the community, definitely our school evaluation health academy, faculty or instructor. Now, course description. This course introduces the concept of community health utilizing the population focus the nursing process. Also, emphasis is on the health promotion, the risk reduction, and disease management in selected community setting. The course assists the student to recognize and analyze the interrelationship between individuals, families, population, groups, and communities in determining the health status of each. The impact of political, economics, social, environmental, and cultural concept on the health of populations is examined. The laboratory portion of this course assessed the students is applying the knowledge of community health resources. Students will learn to manage the community health resource to support the delivery of care to individuals, families, population groups, and communities with a specific emphasis placed on cultural influence of the health practice and belief. What are the course competencies? So particularly upon the completions of this course, the student will able to, right? So analyzes the comprehensive and focused assessment. And this assessment, physical, psychosocial, socio-economical, political, developmental, spiritual, cultural awareness, educational, healthcare, and environmental. Evaluate one's roles and participation in emergency preparedness and disaster response, like cyclone, flooding, tornado. So how we will respond, right? Actually, when a good nurses go through this program or the subject, they always able to assessment the patient with, they also welcome the assessment technologies here, right? And RN, the community nursing review all of the system. So basically, when the student can finish this course, and this guideline help you to locate the important information quickly, assist your learning effort, or provide exercise for applying your nursing knowledge. Also facilitate your entry into the nursing profession as a newly licensed nurse, right? So they said a good nurse can critically analyze the evidence-based practice guidelines, research, and also nursing theories that support identifications of clinical problems, prioritization activities, and implementation of nursing skill and quality outcome of the care of diverse communities, groups, and population. So you see, a good RN are able to identify the disease. What are the clinical problem? So patient come to you and they said, I have a cough for 4 weeks. You have to have the differentiate what are the disease maybe tuberculosis. What are the question marks? The pattern of the cough, any associated fever, weight loss. What else? If your patient say, I have a cough, you think, is it sinusitis? Is it bronchitis? Is it bronchial asthma? So you have to have the enough knowledge in your brain, but you have to know how to apply it. Like a disaster, tornado, you got 10 patients. Out of 10 patients, which one need first? Which one you have to check first? You have to assessment your patient, and then you have to go and give the treatment. So prioritizations of activities. So a patient has a bleeding, you have to stop the bleeding. A patient blood pressure go down, you give the IV fluid, right? So it is the prioritization. So what is my plan? I have to implement it. Intervention, we call implementation of nursing skill. So whatever we do, everything have to have this very good standard. Quality is important. Quality outcome in the care of diverse communities. So who came from another countries, it is regardless. Who is black and white, it is regardless. What is my religion belief, regardless. So we have to respect whatever my belief, right? So diversity is also important. So basically, this program or this course, or when you review all of the modules, use a nursing concept of organizing the framework. And you beginning with a overview description, the central concept, and it's relevant to nursing, right? Also subordinate the theme are covered in outline form of demonstrate the relationship and present the information in a clear, right, in a very clear and transparent manner. So we apply it. Develop the clinical prevention and population focused intervention using appropriate technological aids with a attention to effective, efficiency, and cost effective, and equality. Wonderful, right, my friend? I have a 10 patient and I have a 30-minute. So 10 patient, 30 minutes in my hand, every patient supposed to get 3 minutes. I will not be biased. One patient give 10 minutes, another patient give 1 minute. No, it should be equal. So there are so many diagnostic tests. You have to think about which one is non-expensive, cost-effective. Like a patient has an acne, and you give the antibiotics, tetracycline. Although tetracycline has some kind of side effect, with precursor, you decide to give tetracycline, but patient health insurance does not provide it. It is not a good judgment. Give them something that patient health insurance help to buy it, right? So effective. So examine professional nursing concept of social judgment, advocacy, my friend. You are nurse. Some situation like this, a patient who is only 14 years old and she's pregnant. She does not want to share this to the parents. and you need advocacy to them. You can explain everything, good or bad, but don't bias. Don't put your personal opinion, right? Same thing, autonomy, never harmful, do good, dignity, integrity, right? Related to the health of valuable communities, groups, and population. So, instructional delivery plan. So the format may include lecture, discussion, computer assisted learning, group and individual learning activities. Each week you will complete various combinations on online and classroom assignment, activities, reading, and other methods. Instructional strategies that may be used include the lecture, discussion, demonstration, and media resources like YouTube. But YouTube is a lot of videos. But what you need, we can decide, right? So instructor can help you what you need, because some students work so hard, but they do not know what they should know. Some students do not know even what they do not know. The role playing, simulation lab, team-based learning strategies, audio-visual aid, and computer-assisted instructions, study and practice groups, and case studies. So this is the content basically our students follow. So we have active learning resources, and also our students know how to apply it, right? So when you know how to utilize your materials, nobody can stop you. So you will get your license. So next here, instructor and student responsibilities. So what is my responsibilities? My responsibility is to print out something about this course outline, about the resources, about the quizzes, and exit exam. And how do you pass your NCLEX board exam? Every instructor have to clean out it, right? And what is your responsibilities? Your responsibilities, ask me question. Your responsibility is to prepare your assignment, participate in quiz, reading the PowerPoint, watching the videos, and make a nursing care plan. So the instructor at this course assume responsibilities to provide the information regarding the conceptions of the students on required assignment and activities, right? This course is designed to interactive and therefore require maximum participation from each student. The major obligation of the student is to demonstrate the proficiency while meeting the requirements for this course. Students who need additional help should notify the instructor, who will provide additional assistance. Refer the students to the academic center for assistance. So what as an instructor, what we encourage the student, we tell them, if you understand, it is good. If you do not understand, it is wonderful. You can call me. I will explain one more time. You can text me, you can email me, you can call me. And every instructor supposed to answer. So next go the grading process or scale. So here the method and percentage. So homework and participation 12%, the quizzes 8%, midterm 1 25%, midterm 2 25%, final exam 30%. So all together total 100%. And what are the grades and the scale? So if you get 100 to 95, you supposed to get A, 94 to 85 B, and 84 to 75 grade C. So less than 75 is unacceptable, fail, right? The following the score that will given to the scale. If first successfully attempt, 100%. Second successful attempt, 85%, and third successful attempt, only 75%. Below 75 constitute a failing grade, right? So always I encourage the student to read our student handbook. So what the resources we should follow, right? One of the book is called Community and Public Health Nursing, Promotion of the Health Population, 7th edition by Murray and Nails, author's name. Also, ATI nursing education book, it is called RN Community Health Nursing. I basically love this one, right? They contain very good NCLEX content. And this book can help all kind of categories information like safety and effective care, like health promotion, psychosocial integrity, psychosocial, the physiological integrity, all. What else? Next here, the course policies. So general policy says the student must abide by Evolution Health Academy's handbook policy, including the curriculum, also it is called Associate Degree of Nursing 2022, right? Or any updated version of catalog or policy of institute. Sometimes we can change the policies in policy. Definitely, you have to obey the rules and regulation of the school. So Evolution Health Academy attendance policies. So students are expected to attend and participate in every class meeting. Instructor establish the specific policies related to absence in their courses and communication this policy to the student through the course syllabi. Individual instructor based upon the nature of the course that determined what effective excused or unexcused absence have indetermined the grades and upon the student ability to remain the enroll in their course. Evolution Health Academy reserved the right to determine that excessive absence, right? So whatever, if anything is justified or not, are sufficient cause for institutional withdrawal or the failing grade. So we have the system, but basically our students do not withdraw their from the program or course. The course attendance policies here. The students are expected to actively participate in all aspects of course, right? So that include completion of assigned reading, homework assignment, also the quizzes. So exceptions to this policy can be made only under extenuation circumstance and with the written excuse or for why you are absent. If the student has an acceptable excuse, he or she may get extension of assignment. And those points will not count in his or her grade. Basically, our student is so obedient, they're so smart, they finish the quiz before due date. They're really respectful. So what are the, if you missed anything or any kind of late work, what we could do? So for, first of all, here, what we could do if anything missed. So for any excuse to be acceptable, student must provide the instructor with an original of a documents from competent authorities. And for this purpose, a note for parents is not acceptable. The excuse must specifically indicate the date that are to be excused, must be presented upon the first day that the student returned to the school in person. Also, make-up assignment must be made at that time. And decision on whether to allow a make-up exam, quiz, assignment is the or any kind of the instructor can decide, right? Whatever acceptable written excuse or no makeup will be given. So instructor can decide which day, but you have to provide all of the documents is related to this. So students are only permitted one excused absence from the class exam. If student missed more than one exam with an excuse, the second exam will automatically receive the grade of 0. At such a time, it will probably be best to consider the option to take a hardship withdrawal. And as the exam are most point in the course, in addition, excuse will not be accepted for routine procedure. And students should make the appointment for class time. And students have an excuse, the absence, excused absence for the final if the students are unable to take the final exam at the scheduled time or as a valid excuse. It is up to the instructor or evaluation health academy what options will be available to the student. And this will be based on instructor's schedule as well as the time when the student is able to return to school after his or her absence. And this is one option. The student will be permitted to take a make-up version of final exam. So next here, the final exam is comprehensive. So all exams are closed book. No student produce the student sheet, note card, note from the class, or electronic information, right? It's maybe used in the exam. So you are not allowed to do this. So now little bit talk about the academic dishonesty. So all here I always like to request, please read the syllabi. If you accept or acknowledgement is important. So all type of activities that is considered dishonest by reasonable standard may constitute the academic misconduct. And the most common form of academic misconduct are cheating. Again, I want to tell you, basically, our students do not do it. They always like to follow our rules and regulation. So all academic dishonesty will result in a grade of 0 for work involved. And also cheating in any form will not be tolerated. All work that a student turns in must be in his or her own works and must be his or her own works, I said. So if the student, the brain power did not generate what he or she turned in, it is considered cheating. Example of cheating include, but are not limited to, right? Like any kind of false data, if you provide, or if you copy and paste from other student information, like assignment or any care plan, any student they wrote, you copy paste from there and submit it. It is cheating. So allowing another person to do your assignment, allowing another student to copy your work, and working in a group on a graded items, or if you absolutely copying or closely assigned, allowing other student to copy your work, right? So using anything but your brain power on an exam, quiz, lab, practical. So all of this is academic dishonesty. So now little bit talk about the disruption of learning environment. So basically the behavior which is disrupt the teaching learning process during the class activity will not be tolerated. While a variety of behavior can disrupt in a classroom setting, more serious examples include like abuse or any kind of threatened behavior. A student who failed to respond to reasonable faculty directions or regarding the classroom or behavior while participating in the classroom activity may be dismissed from the class. A student who is dismissed, right, due to any kind of process will be afforded such a right as soon as possible following the dismissal. So some common example here. So, right, when you have time, I like to request you just read it. Okay, so what condition? Like refusal, or also monopolarizing classroom discussion, talking when the instructor or other are speaking, or constant question, interrupt, that is interfere with instructor presentations. It is good not to do this. Or any kind of creating excessive noise, use of electronic device, also routinely entering in the class late or leaving or re-entering the class during the lecture. So what are conditions attributed to physical and psychological disability are not considered a legitimate excuse for disruptive behavior. So what else the other policies? Other policies here, the change of or additional to this syllabi. So you see, or include any kind of reading, exam date if you change it, or any kind of general data from this course may be used by the instructor for research or improve the method of teaching. Grade will not be communicated by phone or email. Grade materials can only be picked up by the individuals to whom it belongs, right? So what else? What are the dress code? So when you come to the school, it is good to follow the dress code and supplies. Like students are expected to wear the school uniform and no other non-professional dress up are not allowed. Also, no eating or drinking are allowed in the classroom or simulation lab. Method of communication grade. So results for each exam will be given the student in a writing immediately after each test or quiz. So if I do fail, right, I need to recap it or redo it. So what is the system? Remediations. What we should do? So students who are not meeting the course objectives and requirements are expected to look for assistant or tutor and their instructor. And it is the student responsibility to make an appointment with the course instructor for next direction. So now here talking the American with disabilities. What are the rules? And now going to show you our week, date, modules, and assignment. So week 1, it is cover 5 hours. And module 1, introduction of community health nursing, the chapter name. And you can read the community or public health nursing book, or you can read the our another ATI book. You practice in lab, watch the videos in Google Classroom. Also, you have to make a summary report from chapter 1 and 2, and you have to sit for the quiz, associated quiz, usually week 1, quiz number 1. And week 2, here, week 2, basically 6 hours. Module 1, introduction to community health nursing. Same book, I said. Same book here. So it is good to read all chapter. So each chapter include the opportunities for you to test your knowledge and to practice applying that knowledge and advice here. So what else? So week 3, 6 hours, module 2, it contains the art and science of community health nursing. Same public reading, read the community public health book, chapter 5 and 6. Participate in the lab work, watch the video in Google Classroom, and also write a summary report on chapter 5 and 6. And review and midterm 1. Week 4, it is 5 hours, and module 2, the art and science of community health nursing, same book, but chapter 7, 8, 9. You participate, practice in lab, watch the video, and also make a summary report, the chapter 7 and 9. And also you should sit for the quiz. So next here, week 5, it is 6 hours, include module 3, factors that influence the health in the communities. So community health, as I told you, health nursing is a population-focused approach to the planning, to delivering or evaluating the nursing care, but it is community-based, right? So community health nursing is a broad field that allows the nurses to practice in a wide variety of settings. And community health nurse promote the health, and community health nurse promote the health and welfare of the client across the lifespan, right? And also the diversity population. So all is population based. So read the same book, but chapter 10, 11, and 12. Participate lab work, watch the videos in Google Classroom, and then make a summary note on chapter 10, 11, and 12, and quiz. Week 6, 6 hours, module 3. The factor that influence the health and communities. The chapter 13, 14, 15. Practice in lab, watch the video in Google Classroom, write the summary report, chapter 13, 14, and 15, review and module, and midterm 2. Week 7, 5 hours, module 4. It is basically aggregate the communities. Chapter 16, 17, 18. Practice the lab, watch the videos in Google Classroom, and make a summary report from same chapter 16, 17, 18, and then sit for the quiz. Week 8, 6 hours, same chapter, module 4. Aggregate in the communities. So you see, the nurses working in the communities should have an understanding of the foundation of community health nursing, basically, right? Like epidemiology, it is the include of this chapter. Also health promotion, also disease prevention, everything is here. So chapter 19 and 20, practice the lab, watch the video and Google Classroom, write the summary report, the chapter 19 and 20, and review the final exam. Week 8, and total, it is total showing week 8, 45 hours, 4 modules, right? Total, I said. So here talking about a little bit more about our theories. So the theory portion contain the week 1. So module 1, it is introduction of the community health nursing. You see the health, so community view. It contain the compare and contrast the definition of health and public health nursing, this perspective. define and discuss the focus of public health, and discuss the determination of the health and indicator of health and illness from population. List the 3 levels of prevention and give example of each. Explain the difference between public and community health nursing practice and community-based nursing practice. Describe the purpose of Health People 2020 and give the example of the topic area that is can compress the nation health objectives, and discuss the community and public health nursing practice in terms of public health core functions, and discuss the community public health nursing intervention as explained by intervention. And what else? The next is historical factors, the community health nursing in context, and describe the impact of aggressive living and population and identification approach to population of health promotion from the historic and also present times. Understand the historical events that have influenced the population health and compare the application of public health principles to the nation's major health problem, and also describe the 2 leaders in nursing who had a profound impact in addressing the aggregate the health, and discuss the measure the contemporary issue facing the community and public health nursing, right? And now go for learning objectives from here. It is objectives means read the community and public health nursing book, or read ATI nursing education RN community health nursing book 9 edition chapter 1 and 5. Also write the summary report from the book and also community public health nursing chapter 1 and 2. Watch the videos on Google Classroom, compare assignment, right, that indicate the instructor. Also, you have to sit for exam or quiz and pass the exam minimum 75%. Next, go week 2. Week 2 contain module 1, introduction and community health nursing, rest of the part. So here, see, thinking the upstream nursing theories and population focus the nursing practice. And next part D, health promotion and the risk reduction. So nursing theory and population focused nursing practice differentiate between upstream intervention, which are designed to alter the precursor of poor health, and downstream intervention, which are categorized by effort to modify individual perceptions of health. Describe the defense theory and their application to community and public health nursing. Also here, theory regarding its relevant to the population of health issues. Explain how the theory-based practice achieved the goal of community and public health nursing by protecting and promoting the health, public health. So health promotion and risk reduction. Discuss the barriers theory of health promotion, include the health promotion model, health belief model, also the transtheoretical theory, and also theory of resound of action. Discuss the definition of health, demonstrate an understanding of the difference between health promotion and health protection. Define the risk factor. Discuss the relationship of risks of health and health promotion activities. Demonstrate the understanding of satisfaction of risk factor by age, race, and gender. And then discuss the influence of various factors on health and list the health behavior for health promotion and disease prevention. And related to the clinical implement of action, health promotion activities. So the learning activities that read the Community Public Health Nursing book, chapter 3 and 4, or read ATI Nursing Education book, RN Community Health Nursing, it is chapter 1 and 5. Write a summary report from book of Community and Public Health Nursing, chapter 3 and 4. Watch the videos on Google Classroom. Complete assignment as indicated by instructor. Sit for the quiz, pass the exam, minimum 75%. The next week, week 3, module 2, the art and science of community health nursing, the here epidemiology, and also community assessment. So epidemiology, identify the epidemiological model used to explain the disease and health pattern of population. Use the epidemiological method to describe the state of health in the community and aggregate. Calculate the epidemiological rate to characterize the population health. Also, epidemiological method in primary, secondary, and tertiary prevention. Evaluate epidemiological study design for research health problem. Community assessment include discuss the measure dimensions of community, identify the source of information about the community health, and describe the process of conducting a community assessment. Also formulate the community and aggregate the diagnosis. Identify use of epidemiological data at each steps of nursing process. So learning activities include the read the community and public health book, chapter 5 and 6. Also, you can read ATI Nursing Education, RN Community Health, chapter 3 and 4. Write the summary report from the Community Public Health Nursing book, chapter 5 and 6. Watch the videos on the Google Classroom and complete assignment as indicated by instructor. And pass the exam and minimum 75%. What else? Next here, week 4, module 2, the art and science of community health nursing. Part 1, Part 2. Part 1, community health planning, implementations, and evaluation. Describe the concept of community as client. Apply the nursing process to the large aggregate within a systems framework, and describe the steps in health planning model. Identify the appropriate prevention level and system level for nursing intervention in families, groups, aggregate, and communities. Recognize the major health planning legislation. Analyzes the factors that have contributed to the failure of health planning legislation to control the healthcare cost, and describe the community health nursing role and health planning implementation and evaluation. Here we go, the community health education. Describe the goal of health education within the community setting. Examine the nursing role in community education within socio-political and cultural context. Selection and learning theories, and describe its application to the individuals, families, and aggregate. Example, innovate and effective technique, teaching and learning strategy that is community-centered in education for individual, for family, right, or aggregate. What else? Next here, compare and contrast the approach to health education with individual health and education model. Examine the importance of community engagement for impacting health disparities. Also outline systemic process for developing cultural and literacy relevant the health education materials, the message, media, and program. Release and apply the factors that enhance the suitability of health education materials, the message, media, and program for intended audience. Also prepare the appropriate and meaningful teaching plan and evaluate the criteria for individual, for family, and for groups. The case management. So define the case management and case management, care management, and compare the difference. Case management and care management. Discuss the philosophy and guidelines principle of case management. Also, identify origin and purpose of case management. Identify the case management process and discuss the rules and characteristics of case management in a reformed healthcare. Also, identify educational preparations and skill recommended for case manager. What else? The learning activities. Read the community and public health book, chapter 7, 8, 9, and read ATI nursing education, RN community health nursing, chapter 3 and 4. So you can follow either this book, Public Health Nursing, chapter 7, 8, 9, or ATI Nursing book, chapter 3 and 4. Write the summary report in Public Health Nursing, chapter 7, 8, and 9. Watch the videos and from Google Classroom. Complete the assignment as indicated by instruction. Also, sit for the quiz, pass the exam within a minimum 75%. The week 5, module 3, factors that influence the health and the communities. So one is policies, right? Politics, legislation, the community health, and also health care plan system. So basically, policy discuss the structure of governmental impact of policy development process and describe the legislative, judicial, administrative process involved in establish the federal law, state law, or local health policy, or even agency policy. Examine the power of nursing to influence and change the health policy. Discuss the current health policy issue. Identify the social, political processes that influence the health policy development, and discuss the nursing role in political activities, and discuss the nursing involvement in private health policies. What else? The healthcare system. Describe the organizations of the public healthcare systems at the federal, state, and local level. Compare and contrast the scope of private healthcare subsystem and public healthcare subsystem. Describe the role and regulation of the members of interprofessional healthcare team, and discuss the relationship of critical healthcare issue to the healthcare organizations and healthcare providers. Also, discuss the future concern for healthcare delivery systems. So, like last 2 years, it was very challenging to face the COVID-19 pandemic. But COVID-19 is almost over. But we have to concern what is coming next. We enough manpower to face it. We do not know how dangerous it would be. So we need to prepare for the future. So, economy of healthcare. Discuss the factors that influence the cost of healthcare. Identify the terms issue in financing the healthcare. Discuss the public financing, private financing, health insurance plan, also healthcare financing. So at least we need to know what are the content of Obamacare, right? What are the Medicaid and what are the Medicare? In emergency, if I do not have any health insurance, who can stand for it? Describe the effect of economics of the healthcare accessories. Access, identify the future of healthcare economics. So what else? What are the learning activity? Read Community and Public Health book, chapter 10, 11, 12. Read ATI Nursing Education, RN Community Health Nursing, 9 Education, chapter 2. and write the summary report book of Community and Public Health Nursing, chapter 10, 11, and 12. Watch the videos from the Google Classroom and also complete assignment as indicated by your instructor. Sit for the quiz and pass the exam with minimum 75%. What else? So week 6, module 3, factor that influence the health of communities, cultural diversity and community health nursing, and environmental health. Cultural diversity, it contains critically analyzes racial and cultural diversity in United States of America. Analyzes the influence of socio-cultural, political, economics, ethical, and religious factors that influence the health of cultural diverse individuals, groups, or communities. Identify cultural aspect of nursing care for culturally diverse individual, groups, and communities. Explain how to apply the principle of transcultural nursing to community health nursing practice. What else? Describe the area of environmental health problem, and related human health risks. Explain how to apply the basic concept of critical theory to environmental health nursing problem, and describe importance of air, water, food quality as a determinant of health. Identify social, cultural, economics, and political factors that contribute the population and impact environmental problem. Develop an understanding of the risk assessment and risk management role of nurses. Explain the laws and regulations relevant to environmental health and how government agencies use them to address environmental issues. Health in global communities. Describe globalizations and international pattern of health and disease, and also discuss the World Health Organizations, shortly called WHO, concept of health for all. What does it mean? What are the definition of health, and what are the meaning of health for all, including in this chapter? Identify international healthcare organizations and how they collaborate to improve the global nursing and healthcare. Describe the role of communities and public health nurse in international health. Discuss the key elements, effective model for successful and international service learning community health project, include international community assessment model and service learning framework. What next? The learning activities, read the community public health book and chapters 13, 14, 15. Or you can read ATI Nursing Education at RN Community Health 9th edition, chapter 2, and also write a summary report from book of the Community Public Health Nursing, chapter 13, 14, 15. Watch the video on Google Classroom and complete assignment as indicated by instructor. Sit for the quiz, pass the exam with minimum 75%. What else? Next here, week 7, module 4, aggregate in the communities. Part A, child and adolescents health. B, women's health. Child and adolescent health contain identification the measure indicator of child and adolescent health status. Describe the social definition of the child and adolescent health. Discuss the individual and social cost of poor child health status. And discuss the public program and prevention strategies targeted to the children's health. Explain how to apply the knowledge of child and adolescents' health need in the planning appropriate comprehensive care at the individual, family, and community level. What else? Women's health. Identify the major indicator of the women's health. Examine prominent health problem among the women of all age group, right? Like adolescents, even old age. Identify barrier of adequate health care for women. Discuss the issue related to the reproductive health. Explain influence of public policy of women health, and discuss the issues and need for include the research effort focused in women health. So next here, explain how to apply the nursing process to women health concern across all level of prevention. And C, men's health. Identify major indicators of men's health status. Describe the physiological, psychological factors that have an impact of men's health status. Discuss the barrier of improved men's health. Discuss the factors that promote men's health. Describe the men's health needs. Explain how to apply knowledge of men's health needs in planning gender-appropriate nursing care for men at individual, family, and community level. What are the learning activities? Read Community and Public Health Nursing book, chapter 16, 17, and 18, or you can read ATI Nursing Education, RN Community Health Nursing, 9th edition, chapter 6. Write a summary report from the book of Community and Public Health Nursing, chapter 16, 17, and 18. And also watch the video and Google Classroom from the Google Classroom. Complete assignment as indicated by your instructor. Sit for the exam, pass the exam, at least minimum 75% score. What else? Week 8. So week 8 content, module 4, it is aggregate in the communities. D, senior health, family health. So senior health include discuss the aging process, So every nurse must know what are the age-specific care or age-specific intervention, right? The infant, they need special care. Elderly patient need special care, prevention of fall. So discuss the demographic characteristics of elderly population, describe social issue related to aging, right? Disabled, dementia. So it is, they need a special care because of aging process. So we have same destinations. So describe physiological change due to the aging, recognize healthy people 2020 wellness goals and objectives for older adult. Describe health or illness concern common to the elderly population. So who is chance to victimized? The elderly patient who is dementia, right? Most chance. Identify the nursing action that address the needs of old adult. Identify resources available to the older adult. Then family health. Give the definition of family, right? Identify the definition, then identify characteristics of family that have implications for community health nursing practice. Describe the strategies for moving from intervention at the individual level to intervention at the family level. Describe the strategies for moving from intervention at the family level to intervention at the aggregate level. Discuss the model care for family. Apply the steps of nursing process to individual within the family as a whole, or family aggregate. Learning activities. Read community or public health nursing book, chapter 19 and 20. Or you can read ATA Nursing Educations, RN Community Health Nursing 9, Education chapter 6, or write a summary report from the books of Community Public Health Nursing chapter 19 and 20. Watch the videos on Google Classroom and complete assignment is indicated by instructor. Also, pass the exam with a minimum 75%. What else? Lastly, here, acknowledgement of syllabi, right? Acknowledgement means acceptance of the truth or existence of something. So if you understand from beginning to ending, if you accept it, if you admission or allowing all of this concern or confession, then you can write your name is here, right? You should write your name. I have received and understand the syllabi containing the policies and requirement for the subject anywhere 109 course. And I have reviewed the syllabi and understand the sub objectives of this course, and I understand how my performance will be evaluated and how my final grade will determine. If you read, if you understand, if you acceptance, if you allow, then you can sign here and put your date, and you can email us. Thank you for your time and listening my word. And I like to thank you one more time. Thank you.